Hello, I'm Karen Smith, the Director of the California Department of Public Health and the State Public Health Officer.
And I am Jamal Miller, Deputy Director with the Office of Health Equity here at the California Department of Public Health.
At CDPH, we have a vision of California in which race is no longer a predictor of one's health outcomes and where all Californians can achieve their highest level of health and well-being. We are pleased to take an important step toward achieving this vision with the official launch of our Racial and Health Equity Initiative.
In May of 2017, we adopted our first Racial and Health Equity Action Plan as an early step in realizing our vision. Over the next few months, as this initiative gets underway, you will have the opportunity to learn more about racial and health equity and engage in various activities. As a first step, we're administering an all-staff equity survey, and we are recruiting for a team to help us implement our action plan. I encourage all staff at all levels to participate in this baseline survey. We will administer this survey every couple of years to track and measure our progress.
Today in our state, for nearly every single indicator of health and well-being, we see differences in outcome by race, with populations of color consistently faring worse than whites. Government typically responds to inequities by developing programs and services to lessen their effects. While these programs and services provide critical support to our most vulnerable communities, to achieve true health equity, we simply must focus on the root causes of inequity. Root causes such as access to quality education, jobs, transportation, and frankly, institutionalized discrimination. In response to this, in 2017, CDPH launched a department-wide Racial and Health Equity Initiative to assess the way we operate and transform our internal systems within our own institution that may perpetuate racial and social inequities.
There is something we all need to acknowledge and overcome. Talking about and working on institutional racism and racial equity is often not comfortable, but is necessary, and it's urgent. It is unacceptable that in our great state, life expectancy can vary by as much as 25 years between people of color and white people in the very same zip code. That's the difference between whether or not you'll see your child graduate from college or see your grandchildren born. The lives of our friends, neighbors, and fellow Californians are ending way too early. This difference in life expectancy isn't due to difference in our genetic code or personal choices. Healthcare quality and access play a part, but it is due to the very real differences in the living and social conditions that shape people's access to resources, opportunities, and risks.
What drives these differences in living conditions are systems and practices embedded in our institutions that work better for white people than non-white people. These same systems also work better for heterosexual individuals than LGBTQ, for men than women, and for able-bodied people than those who are disabled, and so on. Most of these systemic differences are not intentional or even visible to us, but they are now baked into the systems we rely on in our government every day. This means that despite our best intentions, we may actually be inadvertently perpetuating the very inequities that we're striving to eliminate. As a first step, we need to really ensure that we embody these equity principles. CDPH's Racial and Health Equity Action Plan is a 5-year plan. The first couple of years of the action plan are really focused inward on assessing and improving our internal practices and policies. This includes focusing on hiring, recruitment, and retention, as well as building capacity of existing staff to better understand and operationalize equity principles in our daily work. We will continue to build this work over the years and update the action plan as new opportunities arise. I am personally committed to this initiative and committed to making our vision for racial equity a reality.
I hope that you will join us in completing the all-staff equity survey. It's an important step. We will then engage in the work needed to reach our vision.
Thank you.